Hi, I'm Dr. Charlie Galanis, board-certified plastic surgeon in Beverly Hills, California.
Caitlin to see Dr. Galanis. This is my first time coming into the office for a breast augmentation. I am very nervous, but very excited as well. It's something I've wanted for over 12 years now. I'm a very tall, broad-shouldered woman, and I'm happy with everything on my body except for my chest. It's always been that way. It's a femininity thing, and because I've never had that, I've never felt like a full woman. Also, I've been in a relationship for 3 years, and if you do not feel comfortable in your own body, they can tell, which is the worst feeling. I'm just deciding to do what I want, finally, for myself. This isn't for anybody else.
Caitlin?
Hi.
Hello. Nice to meet you.
Nice to meet
I'm
you.
Emily. Come on back.
The first person my patients meet when they come to the office is my patient coordinator. She's with them every step of the way and really serves as their advocate. Of course, after surgery, patients will have my cell phone should they need to get a hold of me directly.
Okay, so I just kind of want to give you some general info before we get started. Usually people come in here kind of nervous, so I just want you to feel comfortable, ask whatever questions may come up. There's no stupid questions.
After my patients are done with my patient coordinator, then it's our turn to meet.
Hello, this is Caitlin.
Hi, nice to meet you finally.
Nice to meet you
All right,
finally.
come on in, we'll chat in here.
Thanks.
This is really my opportunity to get to know my patient on a personal level.
So you're in music journalism, right?
Yes.
Okay, tell me a little bit about that.
I think it's essential to build that relationship, to establish that level of comfort, that level of trust, so that we can move on and talk about things that might not always be the most comfortable things to talk about.
I just want something natural, nothing too large.
With all of my breast augmentation patients, I like to go through all of the basics of breast augmentation. Everything from incision types, pocket placement, and even the different types of implants we can use.
It moves and changes its shape just like your normal tissue would.
Really, I want my patients to feel empowered. I want them to feel confident in the decisions that we're making together. And one of the ways I can do that is by arming them with all the knowledge I can about breast augmentation surgery.
The tissue will stretch out and the implants will settle nicely into place for a little bit more of a natural aesthetic.
That's amazing. I would 100% think those are real if I
Right,
saw
yeah.
her in a bikini.
Yeah.
You know, one of the things that's important to me is maintaining a boutique style practice. What that means to me is really taking the time to get to know my patients and setting that relationship as a priority rather than shuttling patients in and out as fast as I can. It's why I set aside an entire hour for a consult, most of which is spent one-on-one with the patient.
I'm excited.
All right, good. All right, well, our next step's going to be the exam. Okay.
Awesome.
All right, perfect.
It feels really good coming into a doctor's office and not feeling nervous. He makes you feel comfortable, which is the most important thing when you're about to change something on your body.
Mind if I examine you?
Yes.
Okay, perfect.
A pivotal part of this process is really finding that sweet spot between the patient's goals and the patient's anatomy. What that means to me is delivering a result that is consistent with the look they want to achieve while still aligning with their anatomy.
All right, so what we're going to do now is the fun part. Put this bra on, it clasps in the front, so we're going to do the sizing, okay?
Awesome.
One of the things that patients enjoy the most in this process is the sizing. I use specially made bra sizers which mimic a given implant size. This gives patients the opportunity to try on an implant size before going through surgery. It's actually a really fun time for the patients to experience the transformation before it has actually occurred.
All right, I'll go ahead and take a look at those.
Wow. It was kind of surreal to be in the moment and be like, wow, these are gonna be mine soon, and I'm no longer gonna be unhappy with the way my chest looks. I just like feeling them. I just love them. I'm like, I can't wait to have these. Looking so good right now.
Once I meet a patient, I'm invested. So even if they decide to go somewhere else for their surgery, they can still reach out to me with questions. I will remain their advocate because ultimately I want them to have the best result possible.
It looks so real,
Yeah.
so it's getting in my head like, holy, I'm gonna have these boobs. It's weird, I've never had boobs. I've been to a few doctors and it wasn't the same experience. I feel very comfortable. I'm excited to take this journey with Dr. Galanis. I think I can really trust him, and this is gonna be a great success. I'm just gonna go home. I got these. Oh my god, it's so weird going like this too. Oh my god, I'm gonna have boobs.
Yeah, you could. It's possible.